on behalf of Independent Research Ethics Society, AYUSH SAMRIDDHI International Webinar Series at milestone of 2703. Today, we are celebrating Ayurveda Day, 10th Ayurveda Day, with the theme Ayurveda for People and Planet. Thank you. Thank you very much for joining. I would like to welcome all the audience, experts in the audience who have joined us on Zoom. And we would like to welcome all the viewers of YouTube and congratulate them for 10th Ayurveda Day. This year, Government of India Ministry of AYUSH has declared unique theme, Ayurveda for People and Planet. Under this theme, 8 verticals are there. Above all, first importance has been given to little steps to wellness, Ayurveda awareness to students. It is very necessary because our young generation, Gen Z, Gen X, Gen Y, whatever we can say, that is now ignoring Ayurveda and they are interested. But some senior should guide them to use that. And once if they have used, definitely they will be using again and again. So without wasting much time, I would like to welcome Dr. Shekhar Annambotla, my dear friend and brother from USA, Pennsylvania, President, Association of Ayurvedic Professionals. Welcome, Dr. Shekhar. And Dr. Ashish Phadke will also join us in due course. So thank you. Without wasting much time, Dr. Shekhar.
Can you see me?
No, logo. We can see your logo.
What is happening? View profile. So somehow you can't see me. That's interesting. So what can I do? So my video.
What happened?
My video is not showing up. Can you hear me?
Yes, we can hear you. Would you like to deliver your talk on WhatsApp video call?
Okay, let me do it. Let me do that way.
I'm ringing you. If it is not possible here, I'm ringing you.
Yeah, Pawan Sharma. Yeah.
I'm ringing you.
Yeah.
Yes.
Can you see me?
Yes, I can see you. I can hear you. Just a sec. You can share your presentation on WhatsApp also. Just a sec. I'm sharing you on Zoom. Yes. Now you are with us.
Okay, let me close this one. That way.
What happened?
Now it's okay? Can you see me? Hello?
Yes,
Can you see me?
I can see you. I can hear you. Don't worry.
Okay, good. So welcome you all. So today's webinar on the Ayurveda Day and this is the 10th Ayurveda Day, celebrating all over the world, as Government of India, Minister of AYUSH has given a special date on the September of 23rd. In every year, we are going to celebrate. This time, we have given 7 tracks. Today's topic is on the Ayurveda awareness for students. Now, already students who are joining in the Ayurvedic schools, they come up with some intentions when they're coming to the Ayurveda school, like a medical schools, Ayurvedic medical schools. They have a clear picture is that what they wanted to do. Whether they can be an academician, or a teacher, or a practitioner, or researcher, or entrepreneur, or
Mom,
maybe traveling abroad and establish their practices. These are the so many factors they can take into the consideration. So opportunities are innumerable, and some people
They change their profession to the various jobs,
not
allied health not allied health professionals like naturopathy, homeopathy, and medical profession like that. Now our goal is that how we can promote Ayurveda globally.
For that, first of all, India is the prime
Prime location for the Ayurveda development. Of course, Sri Lanka, Nepal, and other countries also very primary licensed professions in now Saudi Arabia, South America, no, sorry, South Africa,
as well as in
Saudi Arabia, and every area is developed such a way.
now. How? What are the tips we can take Ayurveda students? First of all, you can be a multitasker,
Various ways to do it.
such as research,
You can do
teaching
it
profession,
and
practice,
practice.
and entrepreneurship.
Like we can do it, a lot of activities like that. Like Dr. Pankaj Pawan Sharma ji, he's a entrepreneur.
Becomes a
He's a
researcher, the
he's a
practitioner,
practitioner.
he's a
He's a
formulator.
formulator. So many activities he's able to do it. One way he can do it, lot of activities.
But our goal is that our students has to be empowered with that.
That way,
How
how
is our
the students can be empowered like that and then started to maintain with the teachers.
you are
Whether if
interested
you have an Ayurveda practice. So you need to focus on Ayurveda practice and innovative way to create some formulations and everything, and which is helpful for the people and like a so many diseases of diabetes and the mental conditions, various conditions can be cured
are ameliorate the problems like that.
like that. We can do it.
First,
But the
look at
problem is
the
that your
goal is
goal
that
is very clear when you
the
join the
Ayurveda
Ayurveda schools, Ayurveda educational programs.
5 years program you are spending
Spending
in advance that you are doing
doing 3 more years extra training program in the master's program.
our goal is that ultimately
Ultimately,
Ayurveda to be
Ayurveda to be formulated, Ayurveda to be healed. For example,
Ayurvedic graduate who complete MS
MS in Ayurveda in
surgical
surgical
aspect. Let us look into that. How Ayurvedic
wound healing
quality
quality of some herbal formulation or spray or some lotion or cream can be
faster
better than the antibiotic cream or
any other way.
any wound healing quality of the herbs.
So we have to look at that way more
Never to research oriented things like we can do it to help them. Same way, a Panchakama specialist, a Panchakama specialist who
do
is
the community.
performing the Panchakama specialization,
How
how
oil
this all
can penetrate
penetrate into the system
very well
very well,
and how the
and how the
absorption
absorption is happening,
then
and the
brain
blood
barrier
layer, how it is connected to that way, it is improving their health quality like that. We have to work on that. So this
so
is
many ways
the ways to do it. As an educator, as an education, students,
we have to work on that how the the education modules can be created for them
created
for
for
the
and
easy
easily disseminate the knowledge for the students, not only Indian students, in the
globalization
of
where
Ayurveda, how we can
knowledge can be
knowledge can be communicated with them, a general public, as as an integrated health practitioners like a medical doctors, health professionals like that. How we can have evidence-based Ayurvedic education can we bring it?
for that.
Now,
I
I
strongly
strongly recommend in the Western countries what they are looking for
a lifestyle practice
disorders
which can
which
be
can
contributed
contributing to the various
from health problems, chronic health problems,
problems
like
like
rheumatism,
rheumatism, Alzheimer's,
diabetes,
diabetes,
and so
and
on
these
can be
conditions,
surrounded with
how we can manage it with their
Ayurvedic life.
lifestyle, diet, lifestyle, and proper regimen and simple remedies which they can do it successfully to control the
Diabetes,
diabetes or maintain the longevity
life.
of life and everything.
We have
So we
a
have
lot of
a lot of rejuvenation therapies and everything is there. This is a
more Ayurveda awareness to bring.
bring.
And for that Ayurveda awareness to students, first of all, when they come
When
to
they join
medical
the
school,
medical schools, Ayurveda schools,
we
we
recommend them to
recommend
do a lot of
do
assignments,
and the
medical
medical
camps,
camps conducting, the teachers and
institutions
institutions
are
able
able
to
to
do,
adopt
adapting the schools,
adopting the
adapting the
villages
villages
to do
to
the
do
medical
medical
camps.
camps in various locations. When we were studying of medicine, Ayurvedic medicine,
We are able to go to the adopting to various schools where
various schools as well as the villages, we promoted
Ayurveda
Ayurveda camps
so that
so that
education is
education is happening there. Ayurveda awareness is coming.
more
More
demand from the public
the public,
for
more
Ayurveda camps.
Ayurveda can be promoted. And even you
More
can
the
promote
Ayurveda awareness to the
awareness to the
farmers to give the seedlings
seedlings and everything that can help them to grow the
for
more
plants.
medicinal plants and everything.
So many
So
factors
many factors can be contributed for them to improve their
overall
overall health of the
wellness
of the
for
individual and bringing the
more
more
quality of
quality
life,
of life,
more
more
powerful way
powerful way to educate the people. These are the steps we have to do it.
Ayurveda
Ayurveda
awareness
awareness for the students. I
to
think that
particular
the best way is that to empower the
colleges.
colleges and schools and education
Schools
institutions.
are
We are
getting
trying to
all
do all these things, but the government is not supporting. Government is supporting, fully supporting. And
institutions
institutions
work
has to
on
work
that
on that to improve the
quality.
quality of the
Engage
engaging the students, to keep them
them.
in a very active role of the Ayurveda promotion. That's very important.
Not
But not simply that
not
we have to practice allopathy medicine and everything. As an Ayurvedic medicine, we have to practice Ayurveda more. Maybe using of 10 to 20% of the allopathic medicines. That's not another thing.
now
Now,
graduates who are coming out of the Ayurvedic colleges, they
they
feel
don't feel
confident
confident
of the
of the
Ayurveda practice.
Ayurveda.
That's the reason what they are doing
They are doing
80%
80% they are practicing allopathy and
20%
20% they are practicing Ayurveda.
that's
So
reverse
that's
system.
a situation like that happened there. So now we have to change it to 80% we are able to practice Ayurveda. Ayurveda awareness will grow and
Submit
some people are not listening because the reason we have not created the platform for them.
that is the biggest problem.
Biggest problem is happening there.
Like
Like
about
think
that
about it, Baba Ramdev
he's not institutionally qualified.
qualified. He's not having any degree. Any
Associate
university has not given any degree, but he is
with
promoting the
Ayurveda.
Ayurveda from the globally and everything like that.
Our goal
Our
is that
goal is
we have to
we have
have that awareness to
awareness to bring that way, awareness like that, and then we can promote Ayurveda in a successful way. And people are asking nowadays,
who are
people who are asking the Ayurveda graduates, can you
because
help me with Ayurveda understanding and Ayurveda disease conditions and everything? They said, sir, we are not practicing Ayurveda, we are practicing allopathy medicine.
that's the thing is happening there.
Yeah.
People have
A strong foundation of Ayurveda education is very important. And of course, I am pro learning an integrative approach to health. Integrative approach to health. Knowing about that, when to refer the patient to the allopathy doctor.
when
And
that
when
allow
the doctor
when
also he has to refer the patient to the
Ayurveda
allopathy doctor. This
integration approach
integrative approach is there
now
now for
allows
more
them
to integrate the
Ayurveda
Ayurveda and the homeopathy and all the system, yogic philosophies and everything, you can bring them together, then you will be successful practitioner. So that is the thing is very, very important that we have to work on that.
So this is with
With
my
few words,
I would like to conclude
conclude
that
that this is the
the
thing.
Ayurveda is a
Ayurveda
very
is a growing day, and
every
every year we are going to celebrate it. Like our students who are listening to this lecture, they have a lot of opportunities out there in the globally as well as in the various countries also. You can develop it and you promote it. And what is your goal? Individual goal is that what is your goal? Not only thinking about financial part, but name and fame and everything is important. Ethical grounds are also important. These are the factors are important to maintain good health and wellness. Thank you,
Dr.
Pawan Sharma, for giving an opportunity to speak about that. And the students are because
Sharma
Dr.
ji, Dr. Pawan Sharma ji,
Sharma, I know him since a long time, 30 years, more than 25 years.
but he was a student
Student,
also. We are all
we are students. It's a
gradually
great
graduated. He
growing.
still
He's
is
still is a student. He's doing PhD.
so that
So
means a
he's
lifetime,
a student. He's a
lifetime
lifetime student.
is
He's
continuously journeying
continuously
for learning.
learning and things are done. New protocols he's bringing, new knowledge he's bringing and everything. And with his
Great
MD background, medical Ayurveda doctor background, Sharma background and everything, innovative way creating the products like that. That is the thing is very important like that. For example, think about Tankara Bhasma is there. Tankara Bhasma is antifungal, antibacterial qualities are there.
Now,
So now
how many
people are able to do research on the Tankara Bhasma in a form of a lotion.
in green
A
spray
spray.
can be given, and then
Tankara Bhasma is a very simple Bhasma. It can be created in a similar format like that. And
anybody
any, in the home they follow fell down, immediately Tankara Bhasma spray.
and the powder,
Nothing powder can be created.
or it can be a lotion.
Lotion can be created. Sterile lotion can be created.
That
That lotion can spray, and wound healing is happening. How fast it is the wound healing happening there?
better than the allopathy,
Neomycin, soframycin, those type of things and the things of that. We have to work on that in the antibacterial qualities. Even if they wanted to add some turmeric, some
some other
herbs which are antifungal qualities are there, that can be added to that and created in a innovative way, creating the formulations like that. That's very important.
so this is the way
The students have to think in a positive side like that.
how the
How
modern
the
medicine
medicine
there,
is there
how
and how we can actively working on that.
like same thing like and
Acids, for example, antacid is there and gelatin.
and
And
in America
we have an
some
antacid.
whereas
But we can
same
create a formula which is very disagreeable in the mouth
and it can be effective.
effective, like allopathic churnam, tribut churnam, and everything combination like that. It can be dissolvable in the mouth and then having an anti ulcer qualities and healing for acidic, reducing the GERD problems, those type of conditions. It can be useful like that. Same thing with the Ayurvedic nebulizers. And
Can be used
the
by
asthmatic patients who are having severe respiratory distress, those conditions are there. These are the innovative things we have to work on that in creating these things. As an
Ayurvedic practitioner.
Ayurvedic students and researcher and everything, you can help them to promote it like more and more companies can come forward and create these things. It will be helpful a lot. Thank you very much for giving me a great opportunity for this Ayurveda Day. And everybody blessed with having a good health and longevity of life. That's thank you very much. Namaste.
बहुत बहुत हमारा निवेदन किया आपका बहुत बहुत आभार आपकी वेबिनार कब से शुरू हो रही है
अभी
अभी
12 बजे
12 बजे means 1 hour 15 minutes.
1 hour
1
15
hour
minutes
15 minutes.
next
Next.
अभी से कितनी
1 hour
1 hour 20 minutes.
okay thank you.
Okay, thank you.
अभी भी एक तीसरी वेबिनार चल रही है सीताराम आयुर्वेद की जिसमें रविनारायण आचार्य है डॉक्टर रघु है वहाँ का डायरेक्टर जनरल हेल्थ साइंसेस, मोप कुमार है और नेहरा है सेक्रेटरी। ये चारों लोग हैं। सीताराम आयुर्वेद वाली की आज तो चल रहा है मेरा लोग। बहुत बहुत आभार, बहुत बहुत आभार कभी ऐसे ही बरसाते रहिएगा, अपनी कृपा ऐसे ही बरसाते रहिएगा। मैं तो ये कह रहा हूँ, हमेशा ऐसे ही साथ रहिएगा। राम जी आप कुछ बोलेंगे? डॉक्टर निशांत शुक्ला जी, अनम्यूट प्लीज। डॉक्टर निशांत शुक्ला जी, हरिओम।
हरिओम,
मेरी आवाज
नमस्कार।
जा रही है
हाँ
अब
सर,
तक?
नमस्कार।
नमस्कार नमस्कार।
बस अब क्लिनिक से घर जा रहा हूँ। आज 10वें आयुर्वेद दिवस पर एयरपोर्ट और अथॉरिटी ऑफ इंडिया जामनगर ने एक लेक्चर रखा था ओबेसिटी पर। जो गवर्नमेंट ने ये ओबेसिटी फ्री इंडिया के बारे में जो कैंपेन रखा है, उसी के कंटिन्यूएशन में, उसी के सिंक्रोनाइज्ड वे में ये एक जानकारी यहाँ पर शेयर करना चाहता हूँ।
आप स्टूडेंट्स के विषय में कुछ बोलेंगे निशांत जी? 5 मिनट। मेरे आशीष फड़के जी आने वाले हैं।
अभी तो जो है ये करीब 1 साल से शिक्षक तो नहीं रहा हूं, पर फिर भी शिक्षक तो हूं और एक विद्यार्थी भी रहा हूं अभी तक। तो आयुष में और खास करके
आपको व्हाट्सएप पर
आयुष को किस प्रकार से आगे लेकर के जाना चाहिए एक विद्यार्थी के रूप में, तो ये इस चीज पर थोड़ा मैं अपने विचार यहाँ पर व्यक्त करना चाहूंगा। तो सबसे पहले जो हमारे 10+2 वाले जो स्कीम से स्टूडेंट्स आते हैं, आज इसकी जरूरत है। आज हम इसको नलीफाई नहीं कर सकते। हम पुरानी जो मेथड थी कि आयुर्वेद पारंगत से लेकर के आ जाते थे और उनको दाखिला दे देते थे। 10+2 सिस्टम हमारे यहाँ पर जरूरत है। 10+2 सिस्टम में हम देखते हैं कि जो हमारे स्टूडेंट्स हैं, हमारे जो बच्चे हैं, जो हम इस प्रकार से पढ़ करके आते हैं, तो कहीं ना कहीं हम इस चीज को समझते हैं कि जो भी कुछ हो वो प्रात्यक्षिक हो। जो भी चीज हमें दिखे, जो भी हम पढ़ रहे हो, जो हम अध्ययन कर रहे हो, उसका कहीं ना कहीं हम एक या दूसरे रूप से उसको परख कर सकें, उसको हम देख सकें। जब तक हम इस चीज को नहीं समझ सकते, तब तक हम किसी भी विज्ञान पर विश्वास नहीं कर सकते। आज टाइट्रेशन का एक्सपेरिमेंट अगर करते हैं, तो टाइट्रेशन के एक्सपेरिमेंट में जब कलर चेंज होता है, तो जिस पॉइंट पर कलर चेंज होता है वो उस हिसाब से हम कैलकुलेशन करते हैं। जैसे हम अनुमान प्रमाण की बात करते हैं कि भाई इतने क्वांटिटी में ये होगा। अनुमान जो है, अनुमान और तर्क में हम सामान्य रूप से जो है ये अलग अलग समझते हैं। अनुमान जो है वो परफेक्ट होता है, दैट इज अ मैथमेटिकल कैलकुलेशन ऑफ द सर्टेन फैक्ट्स। प्रत्यक्षम अल्पम अनल्पम अनुमान। तो इस हिसाब से हम देखते हैं। तो हम जो केमिकल चेंज हो रहे हैं उसको समझ रहे हैं, जो हम पढ़ रहे हैं वो केमिकल चेंज हम समझ रहे हैं। फिजिक्स के जो भी एक्सपेरिमेंट हम करते हैं, लाइट को हम देख नहीं सकते, पर हम मिरर को रख करके हम पिन प्रेक से पिंस यूज करते हैं और उस चीज को हम समझने का प्रयत्न करते हैं कि भाई क्या फिनोमिना हो रहा है। आज जिस प्रकार से फिजिक्स, केमिस्ट्री, बायोलॉजी में और बाकी के साइंसेस में जिस प्रकार से एक्सपेरिमेंट्स डिजाइन किए गए हैं, और इन चीजों को समझाने के लिए एक प्रकार से लेबोरेटरी में हम ये प्रयोग करते हैं कि जो रियल लाइफ के काफी जो है वो नजदीक होते हैं। ऐसे प्रयोग हमें आयुर्वेद में डेवलप करने चाहिए। अब मान लीजिए एक जो है ये प्रयोग हम स्टूडेंट्स के पास करवा सकते हैं, पदार्थ विज्ञान से ये संबंधित है। तो जो तीनों प्रकार के हम संबंध बताते हैं, तो उस चीज को समझाने में अपने स्टूडेंट्स को भी ये समझाता था कि जो हम संबंध की बात करते हैं, उनमें संबंध जो है द्रव्य कब कहेंगे, तो मैं उनको पेपर का एग्जांपल देता था, पेपर को कट करो, या फिर क्लोथ का छोटा एक टुकड़ा करके उसको कट करवाता था। जैसे जैसे आप कट करवाते जाएंगे तो जो है ये छोटे 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 पीस होते जाएंगे, पर वो कपड़ा रहेगा। जब उस आप एक तंतु को निकाल लेंगे और बाकी के सभी तंतु अलग अलग हो जाएंगे, तो वो आपका जो है वो तंतु रहेगा, उसके बाद वो कपड़ा नहीं रहेगा। तो हमें अगर इस संबंध को समझाना है, तो हमें जो फिनोमिना हो, इंटरलॉकिंग की जो फिनोमिना है इसके बीच में, ये एक हमारा एग्जाम्पल हो सकता है। इस चीज को हमें रोग के परख में समझाना पड़ेगा। जब इस चीज को हम रोग से समझाएंगे तब हम समझ पाएंगे। और ऑस्टियोआर्थराइटिस की आज एक बर्निंग प्रॉब्लम है। तो ऑस्टियोआर्थराइटिस में हमने संधिगतवात के बारे में रखा है, हंति संधि गत संधि शूला टोपो करोति जी, ये लक्षण है। अब जब हम एक्सरे करवाते हैं तो उसको जो है वो एक्सरे में डिमिनिश जॉइंट स्पेस आता है। एक्सरे में हमारे पास सॉफ्ट टिश्यूज की जो है वो इमेजिंग ठीक से नहीं होती है। जो एक्सपर्ट होते हैं, जो इस चीज को समझ सकते हैं, वो एक्सरे से भी जो है वो शॉर्ट टिश्यू सॉफ्ट टिश्यू इन्वॉल्वमेंट को, पैथोलॉजी को जान जाते हैं। पर ये कहीं ना कहीं जो है वो एक एम्पेरिकल ये रहता है, वो स्पेसिफिक या एविडेंस नहीं बनता है। पर हम इस चीज को समझा सकते हैं कि भाई आपके जो है ये मसल्स में ये इसका कैल्शियम डिपोजिशन हो रहा है, या फिर आपके मसल वीकनेस है जिसके कारण जॉइंट स्पेस डिमिनिश हो रहा है। सिमिलरली हृदयसी के केस हमारे पास आते हैं। हृदयसी, गुदगतवात और पक्वाशयगतवात, ये तीनों के तीनों जो है वो similar जो है ये पेशेंट की कंप्लेन रहती है। तीनों में जो है वो बैकएक रहेगा, रेडिएटिंग पेन होगा। रेडिएटिंग पेन में हम हृदयसी की बात करें तो क्रमशः अंगानि पीड़यन करके जो है ये बात आती है। क्रमशः द सीक्वेंस इज इम्पोर्टेंट। तो ग्रदरसी में सीक्वेंस है, बाकी रेडिएटिंग है, पेन है, पर दैट इज नॉट सीक्वेंस वाइज। तो स्विक पूर्वा कटिपृष्ठो रोजा जानु जंगा पदम क्रमात्, तो ये क्रमात् शब्द जो है ये उपयोगी है। तो ये पूरा सीक्वेंस जो है वो दिखाता है। और पेन जो है ये वहां से शुरू होकर के जानू से शुरू होकर के पद तक जो है ये आता है। स्विक से शुरू होकर के पद तक आता है, पाद तक आता है। तो आज हम जब एक्सरे करवाते हैं, आज एक्सरे बेस्ड डायग्नोसिस हो गया, एक्सरे करवाते हैं, सीटी करवाते हैं, एमआरआई भी करवाते हैं। तो एक्सरे में काफी बार हमें जो है ये गैस बॉवल्स, सॉरी, बॉवल गैसेस जो है वो दिखते हैं। तो जहां पर ये बॉवल गैसेस दिख रहे हैं तो पॉसिबली है कि ये आउटराइट हृदयसी ना हो करके गुदगतवात या पक्वाशय गतवात हो, क्योंकि गुदगतवात में पक्वाशय की और गुद प्रदेश की पैथोलॉजी के बारे में रखा है। यहाँ पर मूत्र में शर्करा शर्करा वगैरह हो तो उसमें भी हो सकता है। तो इस चीजों को हमें समझना पड़ेगा और समझाना पड़ेगा। ये एक एविडेंस है, ये एक तरीका है कि जहां पर हम बॉवेल गैसेस शैडो दिख रहे हैं, तो ये हम यहाँ पर अगर गूगल की जगह पर गूगल देना हो तो दे सकते हैं, इसमें कोई दिक्कत नहीं। पर साथ में थोड़ी ऐसी दवाई कि जो थोड़ी परगेटिव हो, थोड़ी डाइजेस्टिव हो। यहाँ पर हृतकी जो है वो ज्यादा काम करेगी, यहाँ पर शिवाक्षार पाचन ज्यादा काम करेगा। शिवाक्षार पाचन और संपस्म, अगर पेशेंट को वातानुलोमन की ज्यादा जरूरत है, वहां पर हम एक और ऐड कर दें हिंगवाष्टक। हिंगवाष्टक थोड़ा मल का रोध करता है, पर हिंगवाष्टक के साथ शिवाक्षार, हिंगवाष्टक और ज्यादा हरितकी, इन तीनों को हम मिला करके दें तो पेशेंट में इन सिम्टम्स में इमीडिएटली रिलीफ मिल सकता है। हम इसमें गूगल का यूज करें, दशमूल का यूज करें तो शायद हमें इतना रिजल्ट जो है वो नहीं मिल सकेगा। सिमिलरली इज द केस विद पक्वाशय गतवात। तो यहाँ पर भी हम अगर इस चीजों को हम देखते हैं, इससे कोरिलेट करते हैं, इसको एस्टैब्लिश करते हैं मल्टीपल सिटीज में, मल्टीपल लोकेशंस पर, हम ये एक ही प्रोजेक्ट लेकर के, हम एक ही फिनोमेना को लेकर के जितने ये मिल रहे हैं उसको एनालाइज करें, उन रिजल्ट्स को एनालाइज करें, और उसके बाद एक आज के परिप्रेक्ष्य में हम थोड़ा डेफिनेशन को, हृदयसी पूरा फिनोमेना है उसमें से एक पार्टी हो सकता है, तो ऐसा ऐसा अगर हम करते जाएंगे तो विद्यार्थियों को समझाना भी आसान पड़ेगा, विद्यार्थियों को समझना भी आसान पड़ेगा। क्योंकि जो पिन पॉइंटेड है, हमें ग्रेजुएशन लेवल पे हमें एक्सपर्ट ही नहीं चाहिए हमें। उनको जो है वो किससे फायदा हो रहा है वो अगर हम दे देते तो उनके लिए सफिशिएंट है। गुदगतवात में क्या करना है, पक्वाशयगतवात में क्या करना है, गतत्व में क्या करना है, आवरण है तो उसमें क्या करना है, उसके लिए पोस्ट ग्रेजुएशन भी जो है ये कभी कभार जो है वो उनकी मर्यादित ज्ञान सामने आ सकता है, पर वो टर्शरी लेवल पर या फिर फोर्थ लेवल पर उसकी जरूरत होती है। बाकी रूटीन केसेस में हमें ऐसी चीजों को ला करके देना पड़ेगा कि हम अपने विद्यार्थियों को जिस प्रकार से मॉडर्न में एसओपी बेस्ड क्लिनिकल प्रैक्टिस है, आज वहां पर काफी सारी जो है वो इजी है, आपका प्रोटोकॉल है, आपका एल्गोरिदम है, हमें उस प्रकार से एल्गोरिदम, हेल्थ एल्गोरिदम में डायग्नोस्टिक एल्गोरिदम, थेराप्यूटिक एल्गोरिदम, ये दोनों हमें ये डेवलप करने पड़ेंगे। और जब हम इन एल्गोरिदम बेस्ड प्रैक्टिस पर फोकस करेंगे तो हमारे बच्चों को आयुर्वेद के प्रति निष्ठा भी बढ़ेगी, विश्वास भी बढ़ेगा और उनको काम करना सरल हो जाएगा, समझाना सरल होगा। जब प्रैक्टिस में वो जाएंगे, जब वो फील्ड में जाएंगे, तब इन चीजों को उनको समझाना सरल हो सकता है। दादाजी का एक ओपिनियन था यहाँ पर, क्योंकि वो इस चीज को काफी हद तक जो है वो अलग अलग करते थे। दादाजी का ये मानना था कि जो ग्रेजुएशन लेवल की टीचिंग है उसको एक लेवल तक या फिर एक मर्यादा तक रखें, पोस्ट ग्रेजुएट टीचिंग को अलग मर्यादा ले जाए। वहां पर उनके लिए भले वही सब्जेक्ट्स हम पढ़ाते हैं आज, सभी इंस्टीट्यूट में सीसी, इवन सीसीआई हमने, आज तो एनसीआईएसएम हो गया, पर वो जो है वो जो एक बार पढ़ा हुआ है तो उसको रिपीट क्यों करना। ऐसे में काफी सारे सब्जेक्ट पोस्ट ग्रेजुएशन में फर्स्ट ईयर में निकाल दिए हैं, पर उन्हीं सब्जेक्ट्स को फिर से पढ़ना ये जरूरी, क्योंकि वहां पर आपका आउटलुक जो है वो चेंज होना था। ये नहीं हुआ है व्हाटसोएवर में भी, पर स्टूडेंट्स के लिए ये इम्पोर्टेंट। और जो पहले चरक के सूत्रस्थान के जितने वेद्य है, चतुष्क जी की जो पैटर्न है, केवल अगर क्लिनिशियन बनना है, प्रैक्टिशनर बनना है, ग्रेजुएट प्रैक्टिशनर में बनना है, तो चरक के जो 30 अध्याय हैं, चतुष्क के अध्याय है, उसको थोड़ा जो है वो समझ लें। हेल्थ के एस्पेक्ट से आपको प्रैक्टिस करनी है तो आपको जो है वो द्रव्य द्रव्य गुण चतुष्क है, तो आपके पास ज्वरग्न दशमानी है, ज्वर किस प्रकार का है, वात का है, पित्त का है, कफ का है, टाइफॉइड है, मलेरिया है, फाइलेरिया है, न्यूमोनिया है, जो भी हो उसको ज्वर हर दशमानी दे दो। 3 दिन 5 दिन दो, 5 दिन में ठीक नहीं हुआ, अब 5 दिन में 3 दिन के बाद कैरेक्टरिस्टिक जो है वो क्लियर होने लगेगी। नाउ
बिल्कुल
वी
ठीक।
कैन गो फॉर हायर सेंटर्स। तो उस हिसाब से हम जो सेकेंडरी ओपिनियन, और उसके बाद हम दोषों के तरतम भेद या फिर दोष के भेद, और उसके बाद अगर है 7 दिन के बाद भी अगर नहीं होता तो उसको दोष की स्थिति तरतम भेद से हम कर करके इसकी चिकित्सा कर सकते हैं। सिमिलरली इज विद स्किन डिजीज, आज सोरियासिस हमें मिलता है, तो सोरियासिस में भी ये पेशेंट को प्रॉब्लम होता है, कुछ एक पेशेंट में इमीडिएटली रिजल्ट मिलते हैं, कुछ एक पेशेंट में कम रिजल्ट मिलते हैं। तो वहां पर जो स्क्वेमस सेल्स में जो चेंजेस हो रहे हैं, अगर वो ऑटो इम्यूनिटी के कारण है, तो हमें थोड़ी जो है वो ऐसे मेडिसिन को यूज करना पड़ेगा कि जो ऑटो इम्यूनिटी को काउंटरैक्ट करे। जहां पर मेंटल हेल्थ रिलेटेड इश्यू है, स्ट्रेस रिलेटेड इश्यू है, तो हमें ऐसी कंडीशन में जो हमारी मेडिसिन में उसमें ब्राह्मी या शंखपुष्पी को ऐड कर दें तो उनमें इमीडिएटली रिजल्ट मिल सकता है। उसी के साथ साथ पेशेंट को मेडिसिन के साथ साथ अगर कोई प्रोसीजर हमें देनी है तो
जी।
हमें प्रोसीजर, धारा है, इवन ये कुछ भी नहीं कर सकते तो पेशेंट को हम पादाभ्यंग भी कह दें तो भी पादाभ्यंग से कहीं पर भी जो है वो डायरेक्ट इफेक्ट नहीं होने वाला है, पर पादाभ्यंग में एक इफेक्ट होता है, दैट इज द सूदिंग इफेक्ट। पेशेंट को मिलने लगेगा जस्ट आई एम फाइन, आई एम गेटिंग रिलीफ, आई एम जस्ट गोइंग ऑन द सेवन स्काई, तो ये जो है वो फीलिंग आने लगेगी। और जब ये फीलिंग केवल 5 मिनट के लिए भी आ जाए तो पेशेंट को इमीडिएटली रिलीफ मिलने लगती है। तो साइकोसोमेटिक हेल्थ को भी हमें एड्रेस करना पड़ेगा। कभी कभार जो मिक्स के कैरेक्टरिस्टिक होते हैं, पेशेंट ऐसे भी मैंने देखे हैं कि जहां पर एक लीजन जो है ये लाइकन का हो, एक लीजन सोरियासिस
जी
का हो,
जी जी।
तो ऐसी कंडीशन में हमें थोड़ा चेंज करके ये ट्रीट करना पड़ता है। एक केस की यहाँ पर मैं बात करके मैं अपना वक्तव्य पूर्ण करूंगा। ये पेशेंट मेरे पास 2016 में आया था और पेशेंट को सिस्ट था, और पेशेंट को सर्जन ने बोला था कि दिस सिस्ट इट्स नीड्स टू बी रिमूव्ड। मेरे पास पेशेंट है, उसको मैंने थॉरोली एग्जामिन किया, फेस पर ही थे और 2 या 3 जो है वो सिस्ट थे। उसके बाद मैंने जो बाकी के लीजन्स थे वहां पर मैंने देखा कि पेशेंट को एक्नी थी। अब ये एक एबनॉर्मल फॉर्म ऑफ एक्नी होती है, जहां पर सिस्टिक जो है वो डेवलपमेंट होती है, जो हमारी जो सिस्ट, जो हमारे सेल्स हैं वहां पर, उसकी जगह पर वो सिस्ट बनने लगती है। दिस सेम फिनोमिना इज इन पॉलिसिस्टिक किडनीज, पॉलिसिस्टिक ओवरीज। तो मैंने वही
जी
जो
जी
है वो यहाँ पर भी यूज किया था, और मैंने गंधक रसायन और आरोग्यवर्धिनी उनको दिया था। पेशेंट गेट रिलीव्ड विदिन 3 months विदाउट ऑपरेशन। उसका जो है वो फेस भी क्लीन हो गया, उनकी जो है वो फेस पर नए एक्ने भी नहीं हुए, और जो
जी निशांत जी।
सिस्ट दैट वाज आल्सो रिड्यूस। बाकी के थोड़े जो रहे थे, एक सिस्ट रही थी, उसमें मैंने उसके बाद 3 महीने, इट मीन्स 6 महीने में कंप्लीट रिकवर हुआ था। उस समय मैंने त्रिफला
जी जी
उनको दिया था। तो
बिल्कुल ठीक।
दिस आर द एविडेंस नीड टू गो टू स्टूडेंट्स। आभार सर।
बहुत बहुत आभार आपका।
आशीष सर ठीक था ना?
बहुत
अमरीश जी, आशीष जी,
बहुत बढ़िया सर, बहुत बढ़िया,
थैंक यू वेरी मच
बहुत
सर।
बढ़िया, बहुत
स्वागत है
बढ़िया सर।
आशीष जी, स्वागत है।
हाँ, मेरी आवाज आ रही है सबको? am I ऑडिबल?
आ रही है, आवाज आ रही है जी, आवाज आ रही है आपकी।
आ रही है ना? हाँ, हेलो, हाँ नमस्कार। एक्चुअली मैंने थोड़ा लेट शुरू किया, पता नहीं चला मुझे कब चालू हुआ, बट जो मैंने सुना निशांत सर का, बहुत बढ़िया, बहुत ही बढ़िया। So today's topic which we are discussing now, that is on awareness of student. So I take this particular topic in little different way. एक तो जैसे सर ने कहा कि भाई आयुर्वेदिक विद्यार्थियों के लिए हाउ दैट अवेयरनेस हैज टू बी डेवलप, क्लिनिकल अवेयरनेस अबाउट आयुर्वेद, about that confidence level which one should use while practicing only Ayurvedic, treatment in our patients. That is one part, but I'm little going little different way, that when a studentship starts in your schools, so what usually we see that we have been taught about basically what is nothing but जो मॉडर्न की सब्जेक्ट्स है, फिजिक्स, केमिस्ट्री, मैथ्स, बायोलॉजी, यही सब चीजें हम लोग पढ़ते हैं in 11th up till 10th, and after that also in 11th and 12th. Okay, and then when we come to Ayurvedic discipline, then student, those who have learned science, 10 plus 2 science karke, when they come to Ayurvedic discipline, they, for the first time in their life, they listen subjects like Sanskrit, they listen to subject like Padartha Vignan, metaphysics, they listen to many Sanskrit treatises for the first time, and then they get fixed, oh my goodness, where we have come. And practically many a times people, they feel that whether should I continue or not. That is the problem. When I started teaching in Ayurvedic discipline, I have seen that number of students, those who are coming to Ayurvedic discipline nowadays, they are coming from English medium, and when they don't understand these particular terminologies, they don't understand even Hindi for that matter. And when their professors, they start teaching in Hindi or Marathi or any vernacular language, then there is a great problem. So I think we should have some, like common language which they can also understand, and we should able to teach them in such a way that they will able to accept it. So what I was saying initially, that in school level in Maharashtra, we have tried that kind of experimentation, that along with their routine syllabus, if we can teach them some of the topics like Tridosha, Siddhanta, Vata, Pitta, Kapha, what is Vata, what is Pitta, what is Kapha, for the school level. We need not get into intricate aspects about Tridosha, but at least make them sensitize, make them know about that. Yes, there is something like Vata, Pitta, Kapha also. There is a concept about Agni. There is a concept about Saptadhatu. There is a concept about Trimala. There is a concept about Swastha. All these needs to be introduced to school level, according to me, and there are many others seniors in Maharashtra, Vaidya Sampradaya, that they are thinking that such kind of exercise should be done. At the moment we are doing at our own level, but on government level also they should exercise this kind of experiment, so that in the school level itself students should get sensitized towards Ayurveda. Number one. Number second, it can also be introduced to their syllabus in the form of medicinal plants, Ayurvedic medicinal plants, for example, tulsi, neem, jamun, and things like that, which are simple, which they are anyway aware of. But while discussing about their medicinal properties, if we can also introduce Ayurvedic properties, then I think they will get to know these kind of terminologies since their childhood. Otherwise, what happens whenever we speak about diet, then people they immediately jump towards asking, "Oh, this is having carbohydrate or proteins or fats." Oh, that is perfectly all right. Not that we should not know about it. We should be aware and having even little bit in-depth knowledge of that as well. But apart from that, if we really want to inculcate principles of Ayurveda at that level, then we must tell them since then when they are in the school or when they are in the colleges, that there is something like Shadrasatmaka, and which are these six types of tests, because in modern physiology they don't speak about six types of tests, they only speak about four, right? So all these kind of stuff should be introduced beforehand before someone jumps into Ayurveda. Nowadays, see, in I think it must be a common phenomenon that all over country, 12th result has already been out, that NEET results are also open. And when you ask someone who is not able to get final number in so-called medical seat, then when you ask that person that where would you like to go, then they usually go on giving different options starting from dentistry, physiotherapy, occupational therapy, pharmacy. But if you ask them that would you like to go to Ayush stream of medicine, whether you would like to go for Ayurveda or Unani or Siddha, perhaps they say no because they are not anyway aware about it. So awareness is a key actually, right? So we should introduce it down the line in their school life, in their schooling, in their college life. That is number one. Number second, when they come to college, then it should be digestible to them. Like I usually used to take unofficial, informal lectures while learning. When I was student, I used to take this kind of, I'll not term it as lecture, kind of discussion with my junior students, that why you are being introduced to Sanskrit, why you are supposed to learn Padartha Vijnan, why you are supposed to do, that time it was Dosha Dhatu Mala Vijnan, now it is Kriya Sharir, then Sharir. Because what we see when students enter Ayurvedic curricula, they are more keen and more getting attached with what is nothing but Cunningham and Gray anatomy and whatnot. Okay, perfectly fine. You should be well versed and you should be confident and you'll be able to learn in depth about modern aspect as well, no doubt. But then if you ask them why you should know Sharir, then the many a times answer comes in a different mode. And if you make them know what is the difference between Sharir and anatomy and how it is different, then why you should know Sharir, from where the term Sharir has come from. So it is coming from Sharira. And what is the meaning of Sharira? Huh? Shiryate yattat shariram. That is the definition of Sharir, the one which is getting destroyed every now and then, every moment. That is Sharir. Then what is the difference between Sharira and Deha? So Deha is a another connotation of body, explaining body. But here it is anabolic approach or anabolic point of view has been discussed in very subtle way. Whereas in Sharira, it is catabolism which is spoken about. So together when we speak and when we look at, then it is metabolism. Now, when you speak about Saptadhatu or when you speak about dosha and when you speak about Agni, and if you explain them why you should be really good at the very first year in Sanskrit, The very basic meaning of Sanskrit is सम्यक रीति से जो भाषा बनी हुई है, सम्यक कृते यस्मिन् सातु संस्कृता. सो सम्यक रीति से जो भाषा बनी है जिसमें कोई एरर्स नहीं है, कोई प्रॉब्लम्स नहीं है, मिस्टेक नहीं है, एंड जो कम से कम शब्दों में, कम से कम वाक्यों में ज्यादा से ज्यादा मीनिंग को कन्वे करती है, दैट इज व्हाट दैट लैंग्वेज इज कंसिडर्ड टू बी संस्कृत. And this, while understanding, and then you should make them understand why you are learning grammar. The idea of learning grammar is not to become pandit, right? But in Sanskrit, when we see Paniniyam or Prarambhik Paniniyam in our days, or Laghu Siddhanta Kaumudi, to be more precise. So that Laghu Siddhanta Kaumudi is there to understand various aspects of Sanskrit. And what are those aspects? So Dhatu Sutra Ganonadi Vakya Linganuशासनम Agama Pratyadesha Upadesha Prakritita. That is what has been mentioned. So why these particular segments or sections of grammar has to be learned, and how it will be useful in learning of Ayurveda. So if it is said to students at that very first year, then definitely they will have that vision to look at shloka, to look at different chapters, or to tika, or to read Samhita in itself, in origin, right? I give some example. For example, we have in grammar something like sandhi and samas. Now in sandhi, you may think that, oh, why this is required? This is unnecessary. Let us remove from the portion or the syllabus. But if you make student aware that why these sandhis needs to be learned and how it is going to be useful, then that can be applied Sanskrit for Shastrartha, Ayurveda Shastrartha applications. For example, there is a Bahuvrihi Samas. There is something like Dvandva Samas, right? So in Dvandva, you have got Acha, Becha, Sicha. It's a one term. And there is something like A, B, C, Ch. Itara itar Dvandva. So in both are Dvandva Samas. But in one, there is A, B, C becomes a separate component or separate unit. And in second, A, B, C, Ch, that A, B, C becomes one unit. Now, Pawan sir, Nishant sir, those who are in clinical practice and utilizing or making our own formulations, reading to original script, they will appreciate what I'm trying to explain over here. That when you look at particular formulations, okay, then that formulation, while reading the shloka of that formulation, if you know that this is to be understood this way, when cha is coming in between two or three or four dravyas, then those dravyas unit has to be taken separate, single unit, equivalent. And when it is together, then it is to be taken together as a one unit. So this is one part. Then secondly, there is something known as, in Sanskrit, in the Raghuvamsha, uh, uh, Vagartha, Samprukta, that first line, and then the end says that end of that shlok says Parvati Parameshwarau. Now this is another kind of sandhi where that Parameshwarau is indicative of two individuals, right? So something similar in Ayurveda also we have, and that is nothing but Bruhatyav. So when the term comes Bruhatyav in the shlok, that means it is not just Bruhati, but Bruhati and Lagu Bruhati or Kantakari. So Kantakari and Bruhati together you have to understood. So this kind of subtle understanding will be possible if you really understand Sanskrit from the basics. Then Sanskrit, you also have something like Vyutpatti and Vyakhya. So particularly Vyutpatti comes from the root values or dhatus. Now, when we have got derivation of particular term, etymological derivation or vyutpatti of particular term, then in that again Sanskrit makes a major role. Like कारेण विल्लति सातु कारविल्लका या अपां मार्जयति दोषा इति अपामार्गा, huh? Or say kena jalaina falati iti kafa, vagati gandhanayor iti vata. So whenever we speak about the vyutpatti of any ayusho veda, ayurveda, so all these needs to be taught or needs to be understood while understanding the basics of Sanskrit. So in our days, at least when I was in first year, and we had 7.5 years program, and I did that after completion of my 12th science. So it was a long time, but I don't repent for that because I think we had enough time to grasp the basic concepts in the earlier years. So we had first pre, second pre, and then first main, second main, and third main. So all these were taught, and luckily we had really good teachers, good masters to teach all of us in very interesting way. So when you learn Sanskrit, if it becomes only Sanskrit, only Panchakarma, Panchatantra, only Raghuvamsham, or only Anuvad Chandrika, it makes no difference. But if you know how you should read shloka, how you should divide that shloka, yeah, with Sandhi Vichhed, or how you can understand which Sandhis you are going with, and how they can be applied in understanding those particular formulation or that particular stuff of that given topic. I think that will be really great job, right? Then even in Padartha Vignan, that is metaphysics, metaphysics is to be considered as the basic substratum of understanding Ayurvedic philosophy, right? I say Ayurvedic philosophy because Ayurveda is based on all these different Shad darshan. Okay, one of the darshan which has very little role, and that is precisely Jaimini Tantra, that is Purva Mimamsa. But apart from that, if you see Sankhya Darshan or Yoga Darshan or Nyaya Vaisheshik, and finally even some concepts from Vedanta, then our Ayurveda owes to all these Shad Darshanas. And because we were taught these Shad Darshanas in this Padartha Vijnan and Ayurveda Ityas also, so that has created a base. And when you then start learning Charak Samhita, Purvardha or Uttarardha, and then different isms which we speak about, then that time Swabhava Parmavad and all those vadas, then you have some basics about what is Sankhya, what is Satkaryavad, what is, all other isms in these darshanas. So I think that is to be taught, and that is to be taught with reference to Ayurveda, and then only one can take interest and go ahead and do the better stuff. Then coming down to Dravya Gun, for example, or Rasa Shastra, again here, if we teach student, create interest within them by giving them possibly latest examples while teaching, as rightly said by Nishan sir just now, that, for example, I give example from Dravya Gun, Yatra Shrita Karma Gunas Karanam Samavai Yatta Dravyam. That is what is shlok which we teach, and we say that okay, now you by heart this, and this is what is the literal meaning, and come on, now you must have understood it. But what I felt and what I was thinking even when I was a student, forget about teaching part, right? So if you take keywords from the shlok, yatra ashrita karma guna. So there is karma, there is guna. Huh? Karanam savai yatta dravyam. So dravya is one part, and karma and guna is the other part, and they are correlated to each other with samavaya sambandha. Samavaya sambandha, we know tantu part and all that has been discussed in earlier lecture as well. So if you replace them in the contemporary terms, then dravya is matter, karma is output. So I replace it for making people understand as in output, that is in the form of energy, and guna is velocity, and what you see is m equal to mc e equal to mc square, right? So E equal to mc square. That is Einstein's equation, and that is theory of relativity. Now, if you make people understand, today's students, those who are coming after 12th science, having a background of Newtonian physics, having a background of Einstein's theory of relativity, they immediately accept this. Oh, yes, this is something really very specific, and we should then they should go ahead in thinking in a positive framework of mind. Otherwise, they just do rectify the shlokas and forget everything. And when they go to third year, they forget all the important dravya and rasa and maharasa, uparasa. They forget everything. So, if we can correlate the current contemporary modern sciences with whatever they are learning, and they feel that, okay, this is what is really making sense, this is logical, this is rational, then definitely students takes interest and go ahead with, right? When while coming to final year, as sir gave a lot of examples, now apart from only focusing on the drugs, I think if we make them connect with the principles. For example, the same example I extrapolated and give another continuation to it. A person comes to you with a chest pain, okay, and really bad chest pain. And when I was doing my MD, I was a houseman, and my boss was not there in our college, in our hospital. He was out of station for some reason. And then I have been given charge. Even my register was not there, so I was the ultimate responsible person. And then that guy came with a note of 1000 comes from trustees note. Time when after taking detailed case history, we conclude that it is anulom gati of uh, apanavayu is getting distorted and becoming pratiloma gati, right? And I explained to students after taking that case and all. After he, of course, he went to his special room, and when I explained that, look, अधो वातस्य रोदेन हृदयस्योपरोदनम. That is a sutra in Charaka, right? So adho atasya rodena hridayasya uparodhanam. So he's getting what he's getting. So if you give something which will do anulomana, like just now sir also mentioned, na, you can give ingwashtak or you can give haritaki. So if you do anulomana and if you give there, then we also make our students know about that they must know the ingredient per se. Like when we say you are going to practice, then you must know what those particular kalpa contains, right? People they say, oh no, we can't by heart Sanskrit. So, but that is not the shortcut. Shortcut is not useful. But if we teach them, if we emphasize them, if we create interest in by hearting those shlokas, in first year we used to by heart that 11, 12, 13. In Dravya we used to by heart 7th, 8th, and 15th Adhyay, Ashtangarudaya, Sutrasthan. Likewise, if you make them by heart some of the basic kalpa, huh? Rarsagandhakalo lohavram shulvavasmasamashritam tripuladigunam prukta trigunam chich. So once you do that in front of them and you tell them, now look, when you are knowing shlok by heart, at the back of mind, you know what you are giving, my dear. Otherwise, you will just get stuck with what sir is giving and you will write those prescriptions and try to imitate. Don't imitate, understand the principle and go ahead with. And then students, they really start taking interest. And some of the single solo drugs, you can ask them to by heart. Goduchi Katukastikta, Swadupaka Rasayani, Sangrayani Kashoyoshna, Lagni Balyagni. Likewise, two-liner slok, if we just make them do by heart as a fun activity, then they really imbibe that and they go ahead in a much different way. Now, coming down to internship and then further followed by your PG, and very rightly mentioned by Nishant sir that the same topic can be taught in a great details in post graduation. So when you learn the same Shari, when you learn the same Dravya Gun, when you learn the same Rasa Shastra or Chikitsa or Shalya or Shalakya, whichever subjects you are about to get specialized in. But if you get to the depth by reading different tika, different commentaries by different tikakar, then perhaps you come to know the different nuances, the minuteness of those particular therapies, and I think that is the gateway for going ahead. I don't even restrict awareness of Ayurveda to students. So students of means doesn't come only Ayurvedic. I teach to students of pharmacy. I teach to students of food and nutrition. I teach to students of clinical dietetics. I teach to students of yoga. What? Ayurveda. So even we have to teach Ayurveda in an applied way to all these different branches. If you are getting chance to teach with them, then I think there is no end to it. And today morning only we spoke about digital transformation. So and use of artificial intelligence and machine learning. So with these kind of advances, if we include that in our teaching and our practice, I think there is no way that students are about to get inspired and get motivated. And what efforts, what exercise we are doing right now, that how we can motivate students, how we can take Ayurveda to students of different discipline at different levels can be fulfilled. I think with this, I end here because my battery is also getting over, and I suppose now it's 9 o'clock, so time is also getting over. So with this, I rest here. Once again, thank you very much, sir, for giving me opportunity to be in front of all of you and share my views, whatever I have experienced in couple of years, either in teaching or in practicing or in research and development field, whichever way. Thank you very much and wish you all a very happy National Ayurveda Day. Dhanyavad.
बहुत बहुत आभार आपका, बहुत
Thank you,
बहुत
sir.
आभार आशीष जी। मैं कंक्लूडिंग के लिए आदरणीय रामवीर शर्मा जी को सादर आमंत्रित करता हूँ। कंक्लूडिंग रिमार्क्स ऑफ दिस वेबिनार, फिर हम अगली वेबिनार चेंज करेंगे।
सर मैं थोड़ा सा लेट ज्वाइन किया, अपने वृक्ष आयुर्वेद पे था ना ये सेमिनार।
स्टूडेंट्स,
हाँ, स्टूडेंट्स के लिए, तो स्टूडेंट्स के लिए मेरा ऐसा मानना है, जैसा डॉक्टर साहब ने अभी जस्ट बात की, मैंने लेट थोड़ी ज्वाइन किया क्योंकि